Now we will explore the physical and cognitive development in the stage of young adulthood. And for this brief first video, I will focus only on the physical aspects of young adulthood. First of all, young adulthood is defined as the period between the ages of 20 to age 40 approximately. And during this time, physical abilities peak. So, what that means is your eyesight is the best, your hearing is the best, your muscle tone's the best, your flexibility is the best, your stamina is the best, your sexual prowess is the best, your coordination is the best. All your physical abilities are the best during this stage. So, if you happen to be in this stage of life, I encourage you not to take it for granted, but to enjoy it and to make the most of it. Now, specifically, the years of the 20s, that's also called emerging adulthood. And emerging adulthood is defined as the transitional period between adolescence and adulthood. So it's where one is leaving their childhood behind and now entering the world of adulthood. Now, once again, talking about physical aspects, we want to talk a little bit about nutrition. And a plant-based diet is highly recommended for optimal health. Now, I did change books this semester, but the last book I was using, take a look at this quote. In a 15-year longitudinal study of 18 to 30-year-olds, those who ate plenty of fruits, vegetables, and other plant foods were less likely to develop high blood pressure than those who ate a diet heavy in meat. So something to keep in mind. Try to focus on those whole plant foods. Now, obesity continues to be a major issue in this stage. We've already been talking about obesity prevention in the earlier stages of life and how it relates to the early stages, but it's a common thread that continues throughout the lifespan. So in young adulthood, it continues to be a concern. Now, this data demonstrates that obesity is not only a major problem for the United States and North America, but it has become a worldwide problem. So this data looks at 2 years, 1980 and 2008, and compares the obesity rates. So the orange bar is 2008 and the blue bar is for 1980. This picture here is for women, and then this side is for men. So you can clearly see that there has been an increase in obesity between 1980 and 2008, and not just for the United States and North America, but for Western Europe, Eastern Europe, Central Latin America, North Africa and Middle East, and Southern Africa. This is for women here. And then for men, we see a similar pattern. We also see a clear increase in the prevalence of obesity all around the world. And one of the main reasons for that is simply the export of the standard American diet to these other countries. So other countries allowing American fast food companies and junk food companies into their communities. And also there has been a flooding of other countries with unhealthy processed foods from large American food corporations. And that's one reason for this global increase in obesity, the export of the standard American diet. Now, I want to talk a little bit about alcohol use, because alcohol use also affects the body physically. So this data takes a look at alcohol use amongst college students ages 18 to 24. And so what the researchers did was ask college students, have you used alcohol in the past month, and how often did you use it? And so what we have is this yellow-green bar is age 18 to 20, and then the blue bar represents ages 21 to 25. So you can see that age 18 to 20, 52% did use alcohol in the past month. For the little older age group, 69% reported alcohol use. How about for binge alcohol use? 36% said yes, they engaged in binge drinking. from the 18 to 20 age group, and then the older age group a little bit higher, 46%. And then for heavy alcohol use, there's not that much difference, 13% versus 14%. But basically, we can see that alcohol use is quite common amongst this age group. Now, we clearly define risky drinking as follows. For men, 14 drinks a week or 4 drinks on any single day is considered risky drinking. For women, 7 drinks a week or 3 drinks on any single day is considered risky. So I encourage you to engage in self-honesty, and if you do drink alcohol, take a look at it, evaluate it, and just make sure that you're not going into this risky area. Personally, I don't drink, but I know a lot of people do. And so you just want to, pay attention and make sure that you're not drinking too much, because that's very unhealthy. And of course, we want to avoid alcoholism. Alcoholism continues to be a major problem here in the United States, affecting about 8.5% of the US population. And it's defined as a chronic disease involving dependence on alcohol, causing interference with normal functioning and fulfillment of obligations. And so we do want to be aware of that, and we want to prevent alcoholism. And that concludes this lecture.